And of course, you know, as I'm telling Ernest that, you know, in a couple minutes he's walking, his son walks in. You know, he's kind of limping a little bit. And he was fine. He was walking around doing everything else. And, you know, as the evening wore on, I told him they may start getting a little sore, put some ice on it. But the point is that a lot of times we do things to appease the parent, try to help them. And that's the only reason we give Tylenol or Motrin. You know, and of course, if it gets above a certain point, then you have to do it because you don't want protein to denature. And if a child gets a seizure too high, they can, if a child gets a fever too high, they can have a seizure, they can have other types of problems. But generally speaking, it's a good thing to have a low-grade fever because it shows your body is responding to something. Now, if you have a person that's sitting across from you and, you know, one of those type of people that if a truck hit, the only thing that would be damaged would be the front end of the truck, and, you know, the truck driver may end up suing the guy that he hit because he's that healthy. And that person is sitting there saying, I never get sick a day in my life, then that person's probably got a good immune system. But that's a rarity. You're not going to really see that often. Usually when a person says, I've never been sick in a day in my life, when I'm seeing them, they've already got cancer. They're coming to me because they've got cancer. They're coming to me because they've got this problem or that problem, and that's part of their history. I've never been sick a day in my life. So it's not a good sign. Persistent organic pollutants and heavy metals, the first and second toxicity, depress the immune system and allow these opportunistic things to set up house, and these opportunistic things then cause what we call a subclinical infection. It's a low type of infection, low chronic infection. You said you worked for an oral maxillofacial surgeon? MD, DDS type of thing? Or was he a DMD, DDS? Okay. Okay, so did he ever do anything with, have you ever heard of cavitations before? He didn't do that. Cavitations, anybody heard of cavitations before? Okay. Cavitations are basically when they take out the wisdom teeth, they pull out the wisdom teeth, they sew everything up. There's nerves, there's blood supply, there's tissue, and they just leave it all there. They sew everything up, and it forms like a pocket and like an abscess, but it's a low intensity infection. It's not a high intensity infection. So it never drives you to the point where you start getting sick and get fever, but your immune system, it's kind of like grinding constantly, trying to keep this thing suppressed. And cavitations have been associated with many types of chronic diseases, especially brain cancers. Now, I know this may sound way out there in left field, but there are many dentists that have established this. And actually, you go in with a syringe, and if you try to pierce healthy bone, it's very difficult to do that. But when they've got a cavitation, it just goes right through, just pops through like styrofoam. The needle goes through, and you can aspirate, all sorts of muck. And so cavitations is a huge issue. When they take out the wisdom teeth and then they sew it up, they don't debride that area, and they just sew it up. And so over time, it forms an abscess. It forms a cavitation. It forms a cavitation. Oh, every dentist that takes out wisdom teeth forms cavitations. What I was asking was whether he addressed them, whether he went back, and very few doctors do. Very few, because most don't even realize that there's such a thing, and the few that do realize it, they actively, and I think in North Carolina there may be 4 doctors that I know of that do cavitation surgery. In fact, I have a cavitation. I need to go get it taken care of. And a lot of us may have it. We just don't know. Yes, ma'am.
That would be any tooth extraction, right? Not just wisdom teeth.
You're right. It could be any tooth. It's usually the wisdom teeth because they're the ones that form the big pockets and they've got the huge roots that go in there. But you are correct. Other teeth you can't have a cavitation in any of the teeth. It's usually when they pull the tooth out and put a false tooth or something else, a prosthesis or whatever it is. That's when the cavitation is formed. So most people who had their wisdom teeth pulled out, that's one reason. That's usually the area. And we'll get into this when we talk about the energy aspect, but how many people know what qi is? Everybody? Qi is the Chinese word for energy, the flow, and acupuncture is basically opening up those meridians so that qi can flow. So a lot of times, different teeth having been operated on and abscesses forming or scars that form will prevent qi from flowing in certain areas. And this can, some of the acupuncturists can actually measure it. So everybody got the first 3 toxicities, okay?